Hi, everybody. Welcome back to Tough to Treat. This is episode number 229. And on this episode, we're going to be talking a little bit about kind of a combination of details with a what I would consider a complex client. On surface, she looks pretty simple, but there isn't really anything simple. But this turns out to be a little bit more complex than everybody thought. Sometimes it takes integrating the information to get to the story. So thank you for joining the podcast and enjoy it. Welcome to Tough to Treat. I'm Susan Clinton, one of your co-hosts, and I'm here with Erica Mello. Hi, Erica. How
Hi,
are you
Susan.
today?
I am doing okay. I'm doing okay. And yourself?
Doing well. As we're recording this, Milton is headed towards Florida,
Yeah.
and that will be long over by the time anybody hears this podcast, but our hearts go out to everybody in the path of these big storms that have come through this year so far.
Yeah.
Be safe. Let us know if we can help in any way.
Yeah.
All right, let's get to the podcast number 229, closing in on 230 podcasts.
Oh,
So
yeah.
here we go. So this is kind of more of a discussion type thing that I'm hoping you'll be able to kind of share some of your thoughts in with me as well, Erica, on this. This is a story of a lady who's in her later 60s that came to me, this was a while back, came to me because she was having issues with her left shoulder. And, so the reason that she wanted to come to physical therapy was she was really trying to do some weight training for her bone health.
Okay.
So, that was the initial top story. Her history, as she told it before we got into the timeline, was that she had a previously left frozen shoulder. She felt like she recovered well from it. She had a good experience with somebody who knew what they were doing, and it took about a year, for it to freeze and then melt. And she felt like that she had good support getting back, to where she was. She was living in another area at that time. That was several years before she came to see me, like almost like 15, 17 years. So it was a good distance behind. And after that happened, she ended up getting postmenopausal breast cancer, and it was on the right side.
Right.
And
Okay.
so, which is, because I asked her about her bone health. I said, tell me a little bit about that. What's going on? Thanks for, we talked about the frozen shoulder piece and how that could be one of the reasons that she's having the issues with her left shoulder now because she's loading it. But I said, let's go a little deeper. So she told me about it wasn't hormone receptor positive, but she was not put on any, she has been told by her oncologist not to do any hormone replacement therapy. And she feels like at this later date in her later 60s, she understands it's not that helpful now anyway. So, but she's concerned about bone health because of the chemo that she had,
Yes.
radiation that she had, and that was on the right side. And I said, is your right shoulder bothering you with the work, the stuff you're working on and doing? She said, no, not really. It's the left one that's bothering me. So
Yeah.
I said, it's just interesting to me. Always, one of my questions is, what do you think is going on? And she said,
Yeah.
I'm just wondering if I overused my left shoulder when I was going through the breast cancer. Even though I'd had that kind of thing with the frozen shoulder and the whole thing. And I'm just wondering if I just overused it with the right side, or, I don't really know. And it's like, it's okay. And I said, tell me about any other past injuries, problems, history, stuff. And what actually came up was that she had an very old neck and shoulder, which she called a neck and shoulder injury from chronic bike riding.
Mm-hmm.
And
Okay. Chronic bike riding. I love that
chronic
term.
bike riding is what she told me. And I was like, can you talk a little bit more about what chronic bike riding means?
Yeah.
That I
Yeah.
was like obsessively, compulsively riding my bike all the time, everywhere. And she said, I just kind of
Interesting.
went through this thing where I just felt like I had to always be on my bike. I could never be in a car. She said it was just this thing that I did when I was in my 20s.
Yeah.
and until this happened. And then she said, then I realized I had to start doing things a little differently.
Hmm.
But anyway, she said that she was always turning her head to the left, always turning her head to the left, because you always have to look behind you, even though she had mirrors. Because
Mm,
she was riding her bicycle to the grocery store. She was riding her bicycle through traffic. She was riding her everywhere. I mean,
mm.
this wasn't somebody who was out on the trail, every day for an hour, just, right, or mountain biking. This was somebody who was like an urban, you
Yeah.
know, and,
Like Manhattan, like New York City, like where I
yeah,
am. Yeah.
like an urbanite running into traffic,
Yeah.
only in
Yeah.
places where people didn't know about bicyclists and traffic. So,
Ah, got it.
but it wasn't a
Got it.
city that was used to bikes being everywhere.
Right. That's true. Well, that's definitely not us.
So it is, but interestingly enough, right? Like that, how
Yeah.
what happened there? And she said that, I said, "Can you tell me about the injury? Did something happen?" And she said, "No, it just my neck started bothering me, and then my shoulder started bothering me, then my arm started bothering me, and then the whole thing got so bad I had to quit riding my bike." And she goes, "It was probably a godsend because I might have just kept on with that crazy behavior until something did happen to me." And I said,
She
"So
didn't see.
all of this, you weren't in an accident, you weren't in an injury, you didn't fall off your bike, you didn't do it." No, nothing. She said it just started in my neck, and I remember it going like spreading across my shoulder and into my arm. And it just, I couldn't do it because every time I turned to the left, it hurt even worse. And so she
She,
had to quit. Yeah.
she didn't seek therapy or anything like that, or
Nope.
just she
Nope.
just took matters into her own
Just,
hands.
she
Okay.
just stopped riding her bike, and she said, I was 29 years old, what did I know? But
Yeah.
anyway,
Of
she
course.
just
Yeah. Yeah.
yeah, just stopped. And she went to a doctor, and they just said, well, it'll probably get better. It probably came about from what you were doing, so let's just see how it goes. And she said it did get better, so I never thought about it again.
Right. Yeah. Makes sense.
And she's a very busy woman who works in corporate America. And now, in this day of her life, she had left corporate America and was working for a foundation, which is why she ended up in the same town that I was in later
Mhm.
in life. She was in corporate America when she was doing the breast cancer and the frozen shoulder stuff and everything that happened there.
Yes. Yeah.
So anyway, so if you think about that timeline, we've got this old neck and shoulder injury, probably some sort of super irritable, facet, or maybe even a, disc. She never did an MRI. They never did a myelogram. They never did anything to like really look at that. She said they took some X-rays, but you know, she felt like that everybody thought she was young, so she would be fine.
Mhm.
And
But
I,
she was riding her bicycle everywhere,
yeah,
everywhere.
yeah, all the time.
Yeah.
So
Yeah.
anyway, yeah. So I just thought that there was an interesting kind of thing, and we really explored that because I really wanted to get kind of a little bit more like out of that, and the stopping the riding the bike. To her, I said, "So, besides the pain, what made you stop?" And she goes, "It really kind of woke me up to think that I'm probably doing something very unsafe."
But it's so interesting because she rode her bicycle everywhere and clearly enjoyed it. And for her to stop like that, that that was
I
the
know,
first thing I
right?
was like, why is that? Yeah, that's
Right,
what I first
exactly.
thought.
That's why I wanted to explore it. Yeah.
Yeah.
And she said
Yeah.
it just started to occur to me that I was doing something very unsafe, that I was putting
Really?
my life at risk, you know, doing this. And so she said it really made her take pause. And she said she had to like really like she sold her bike so she wouldn't be tempted to ride it.
Yeah, that's
And
very
I
drastic.
said, "Well, what did you replace it with?" And she said, "Oh, I walked as much as I could." So
There we go.
she was still out walking and moving, but she goes, "I wasn't diving in between cars and traffic and, just like,
But
you
she
know,
went from one obsession to another. Like now she walks
exactly.
everywhere and she bikes
Yeah.
everywhere.
Yeah. She's in corporate America, so she works like 90 hours a week.
Exactly. Exactly.
So kind of that, fast-paced moving. The frozen shoulder caught her by surprise. She thought it was like her neck stuff coming back again, and so
Hmm.
did everybody else, until she finally got into the hands of a good physician, orthopedic, who said, "No, this isn't has nothing to do with your neck. This is what we call a classic frozen shoulder." And he said, "When was the last time you had like good detailed blood work done?" So
Mm.
he sent her back to another physician that he knew, and they actually did a bunch of blood work with her. And because they were looking for like things like RA, they wanted to be sure that, was she diabetic, and not an unknown diabetic, because some people can be slipping around on the cusp of it. They were just looking for the reasons for, this to happen. She did have some high inflammatory markers at the time. She was not diabetic. Her numbers were good there. She didn't have any other issues as far as, like her RA factors and stuff were fine. And so the orthopedic said this is just a classic frozen shoulder for somebody in perimenopause. You
Yeah.
know,
Mm,
he goes, usually it's type 1 diabetics that get this around this time, but oftentimes
okay.
we're learning that more and more women can run into this situation. So they did some hormonal testing with her, and she just was more interested in like, what do I need to do conservatively to do this? And so she had a really good physical therapist that was able to stay with her through the
Mhm.
freezing phase, through the painful and then the freezing phase, and kind
Mhm.
of kept me
Wow.
going, giving me stuff to do that I could do that was easy to just keep going. And then as she was starting, to go into the melting phase, they were gradually helping her, get her shoulder back in
Mhm.
motion and in line. And I said, did they ever use any terms with you? Like anything? I didn't want to put words in her mouth. I just wanted to kind of get an idea of what she knew. And she said the only thing that they said to me was that maybe there was some sort of protective response from those years back then. And I said, well, it was that them that said that? Well, I kind of had to talk with them about that because I wondered. So
You mean the protective response around her bicycle stuff?
yeah,
Yes.
yeah.
Got it. Yeah.
And I said, I think that that is probably, extremely intuitive of you.
Yeah.
So, and then she talked about the breast cancer and it was on the other side. And so she was glad she never really did the hormones, but she said that, they still would like for her not to. And at this point, she just doesn't even want to like talk about that. And I was like, fine, because, the research right now points out that the time they're the most beneficial was at the time when you couldn't take them because you were going through breast cancer treatment,
Exactly. Exactly.
right? When you were
Yeah.
50-ish. So,
Yes.
and she said she recovered well from the breast cancer, and but she wonders if maybe her arm, just never really had a chance to recover well because she had to depend on her left arm so much during when especially with the radiation and stuff with her right arm, and
Mhm.
she
Yeah.
had to do therapy for that, and so that's kind of where we are. So I said, so what is your medical status now? And so she did say that a couple of years ago, her blood pressure started to rise. So she's on blood pressure medication. And, but that's the only thing that's going on. Everything else, her numbers are still good. She looks good. She's active, but she really wants to do, she said, there's concerns out there that I have osteopenia because of because of the cancer treatment,
Mhm.
the chemo that they gave her, and then the radiation. And I said, did they tell you that you had it, or did they tell you you were at risk for it? And she said, I don't know. And I said, did anybody ever do a scan, like a DEXA
Right.
scan or anything for you? And
Yeah.
she said no. So I said, well, the first thing is get in touch with your doc and let's be sure we know what we're dealing with here.
Wait a minute.
Right?
She's in her late 60s and she's never had a DEXA scan before?
In her late 60s, yeah.
That's crazy.
Right. So I said, let's be sure we're dealing with what we're let's know instead
Yeah.
of guess. She's
Yeah.
one of these
Yeah.
people
Yeah.
that like you said, from like in her 20s, she just takes it into her own hands and does what she wants
Yeah.
with it. And
Yeah.
it's like,
Yeah. Yeah.
you've been so good about these other things, and maybe this is something to, you sometimes we have to advocate for ourselves. So just ask for it. And she goes, oh, I'm sure they'll do it. I just didn't never think about it. So anyway, so she had a DEXA scan. She was slightly osteopenic, but nothing really out of range. Something, and
Mhm.
again, risk. So but her whole deal was that she wanted to start doing. She doesn't want to do CrossFit. She doesn't want to be crazy, but she would like to be able to do some weight lifting, some strength training at the gym. But every time she tries to do it, it hurts her left shoulder. This time
Okay.
decided that she wasn't just going to push through it because she goes, I was worried that something that's going on. Again, here's that protective response coming through that actually is serving her rather than holding her back in many ways. It's kind of like, when is the protective response good? And when is it like, it's not good
Yes.
because it may be telling her the wrong story, but it is good because she's seeking care.
Yes. Yes.
So so the thing there. So the other red flags, I just wanted to bring this up because this history is kind of a little bit telling to me that, here we are, we have somebody who's had, what got her there, that shoulder, neck issue, overprotective response, probably.
Mhm.
And,
Yeah.
probably some biomechanical musculoskeletal issues that are real, all of them
Yeah.
together. And then she's somebody who, a busy lady in her, corporate world with breast cancer, a frozen shoulder, some of these different things, really having to look outside the box to see all of these things. And, kind of sitting right in front of me is somebody that you just have to look at left. And so I asked her questions about her left shoulder pain. Is it only when you exercise or try to work out? Well, no, it
Mhm.
hurts when I sleep on it, but that's always been true since the frozen shoulder
Yeah.
case. It's I have to be careful when I roll over onto my left side. And I said, any other time? Well, I can be sitting around and it can be aching. And it's
Yeah.
like, aching how? Well, I
Yeah.
don't know. Like she would just grab her shoulder, the side of her shoulder, like around the deltoids, and it just starts to ache. And I said, does it feel better if you change positions? Sometimes it just aches for a bit and then it goes away. And I said, when you talk to your doctor about the DEXA, which I'm going to actually you're going to pick up the phone and make an appointment right now. I took
Mhm.
her blood pressure. Her blood pressure was fine. I said, you really need to talk to your doctor about getting a really good cardiovascular workup. Let's be sure.
Mhm.
And I know people are sitting there thinking, well, her blood pressure was good. She's very active. She's fine. Nobody's doing this. But you've got somebody who is having this kind of like weird stuff going on, and she's 68. And,
Okay,
although
Susan.
it's not,
Exactly.
it's not typical to be the left shoulder, it oftentimes presents in the left shoulder.
Yeah.
Let's
And
be,
also, what's the number one killer for
yeah,
women?
right.
Heart disease.
Cardiovascular disease.
Hello. Yeah. Exactly.
Mhm.
Yeah.
So the blood pressure was especially since it started rising a couple of years ago. I was
Yeah.
kind of like, does anybody else know that you've got this like left shoulder thing going on? Oh
Mhm.
no, we're not worried about that. The blood pressure was a big deal, and the medication and her blood pressure was good when she was there.
Yeah.
She wasn't in distress. She didn't look like she was having a cardiovascular event or anything at the moment. But,
Mhm.
so we got her back to her PCP, who did order the DEXA and got her in to see a cardiologist. And they
Yeah.
did the whole workup. And, again, they talked to her about, they wanted to they wanted to put the, I can't even think of it now, the
Oh,
harness,
the
a
Holter
halter
monitor.
because what they were most concerned about at her age without having, other significant events was she running into AFib.
Right.
And and that was okay. So they're just keeping an eye on her, which was great. Like, we want you back in every 6 months. You have some risk
Mhm.
factors. Let's just be sure, because of the
Yep.
chemo, because of the breast cancer, because of this, because of that. Even though your numbers
Mhm.
look good, let's just be, really good, because these are
Be
the people.
proactive.
Yeah. So anyway, so I just wanted to bring that up because this was, I think, kind of, we talk about this stuff in our podcast, but sometimes we don't. And I thought it's a good time to pick up this and really remind people that you got to do some good red flag screening. You just have to. Especially if you're just kind of going, something just isn't adding up here. Let's just make
Yep.
sure there isn't anything else going on
Yeah.
that we
And
need to
that
make sure it's
ex
okay. Yeah.
exactly, and that's sort of like, um, your review of systems. I'm into, I
Yeah.
have to do a bunch
Yeah.
of case studies for school right now. Do you need to, is the person a candidate for physical therapy? And we kind of gloss by that because the people that we talk about on our podcast are quite complex. They've been through a lot. But I literally just had somebody in here in my office who chronic left rib issues, and I was her first line of defense. I was her first person.
Mhm. Right.
and she's very proactive. She ended up getting an EKG herself, and she had left-sided issues. And so, but the review of systems is so important. And is a person a candidate for physical therapy, and especially at her age, she's not on hormone replacement. She's had breast cancer. She's had chemo, heart
Mhm.
disease. It is well known that women's cholesterol, it does get elevated in menopause. And the HRT, which obviously she can't take it, but it is, estrogen is heart protective. And that's why it's, Heart Disease Awareness Month. And for women, I don't know what month it is. It's you wear the red dress because it is the number one killer of women,
Mhm.
and we've made great strides with breast cancer, but women tend to, in one of my differential diagnosis courses I've taken recently, a couple of years ago, we kind of, and I will be the first to admit this, we do gloss over a lot of these things,
Mhm.
we really do.
Mhm.
And like you were saying, the gut feel, like you take everything into account. Does what you're seeing match her story? But what was interesting is that she just completely stopped bike riding.
Yeah.
Like like in that, it usually it's like I'm going to keep going, and but she just cut cold turkey, right?
Mhm.
And took matters into her own hands. And
Mhm.
the fact that, and this is no judgment at all, but she's in her late 60s, she should have had a bone scan,
Mhm.
at least one, right? And that's maybe not her fault, but whoever's advising her from a doctor perspective, her OB or whatever, or GYN, they should be asking those questions, right?
Mhm.
Oh, she has breast cancer. Maybe she has chemo, right?
Right.
And so she's not even getting heart stuff isn't even going to be on her radar
Right.
at all,
And it
right?
wasn't. Mhm. It was like,
Exactly.
because of my bone health, which was that was her gateway drug into getting everything else done, which is good.
Well,
'Cause then
but
she's mm,
no, I'm just thinking of, but in women, this is just sort of recalling from what I've learned recently. MIs, heart attack, heart disease, they present very differently in
mhm.
women, very differently than men. I mean, very differently. And I was not 100% aware of that when, like, I knew that, but I've been a therapist a long time, right? And so, I don't tend to see that type of population. But when it's brought to your attention, like, okay, yes, the heart attack, heart disease does manifest differently in women. And as a women's health practitioners, it doesn't you don't even need to be like a pelvic health practitioner. If you treat women, you're a women's health practitioner, right?
Mhm.
At the end of the day, and I don't know if anybody outside of yourself, would have suggested that, in terms of going to rule that out.
We
Um,
hope that they would. We hope that they would. But yes, it's important. Pay
Yes,
attention to
yes,
what's
we
going on with
hope.
you. And listen, I've seen women have left-sided issues, and
Yes,
when they finally get the right workup, they've already had a mild event or something has happened or it's brewing. And
right.
it can look very much like that, and it can look also that's why we, look to things like chronic indigestion, and if they're diabetic on top of it, because the coronary arteries are the first ones to have neuropathies.
Yeah, I didn't know that.
Yeah,
Interesting.
the first ones. That's why diabetics, type 1 or type 2 diabetics do not feel or have the same sclerodermic pain syndrome that you would get from a visceral origin from the heart, from the coronary arteries, because they don't
Yeah,
have that they've got a that's the first place neuropathies will show up way before the hands and the feet.
yeah. It, it is interesting, and it just reminds me of the person I just saw. She thought she had shingles. Okay, and she had little red marks on her back, and I'm like, I know her doctor, and she took pictures. He's like, it's not shingles. I would agree with him, but she also said her fingers were swollen. I'm like, okay, this is not.
Something's
it,
wrong. Yeah.
something's a bit off. She's improving, but my point being is that these little things that people gloss over, eh, and she's the advocate herself. She's, one of these people who like will see a doctor and will text the physician, right? But a lot of people aren't like that. And who like this patient, like she wouldn't have probably like it's not on their radar, and you almost wonder if she, because of all what she's been through, if she's just like, okay, well, blocked it out in a way, or just or just didn't know better, right? And so, but the DEXA scan for me just clued me in, and that's not good.
Yeah.
Because once you've seen an X-ray of a woman who's had a hip replacement, who has osteoporosis, and who develops avascular necrosis, you will never look at an X-ray the same ever again.
Yeah.
And
It's crazy.
okay, right, and that is, and I saw that, and I was just like, and the quality of life is associated with something like that, So, I love this story. We could go on and on and on and talk about this, but
Right.
um,
Right.
uh,
100%.
you
So
know,
since it is a podcast about treating this, obviously to me, I was going to take a look. Her shoulder was meaningful to her.
yeah,
But I also, I wanted a little bit more of the story. So we looked at movement. We looked at
yep,
show me.
uh-huh,
You do what? Like, does every exercise hurt? No. Which ones hurt? You know,
mm-hmm,
obviously trying to do like dumbbell bench press, bent rows, even bicep curls bothered her, working up into tricep curls, just like the latissimus pull down was okay. She was doing just she was trying to do basic exercises. So we just went over and watched her move. Her movement, stuff wasn't bad, but it didn't look like it was a joint issue. But
mm,
because she came to me for, her left shoulder, it was easy to just run through a little manual exam and just check glides in all
mm-hmm,
directions.
mm-hmm,
And, with the exception of a little decrease of an inferior glide, which, again, she's had chemo, she's, in her body, the breast cancer is on the other side. She's had a frozen shoulder. I felt like there was probably some fascial restrictions up into the
yeah,
hip, probably from way back when she was like having the neck and shoulder and arm pain. What
yep,
did, again, we talked about this yesterday, the other day on the podcast that we did with you, the last podcast that came out 228, looking at nerve glides. Had
yes,
anybody done that with her? And those were the significant issue for her. It was like when I
yeah,
got her in the position to look at different nerd glides, and I did it upright. I did it laying down and I did it upright because I wanted to see if it was different. And it really wasn't. That was a spark to her, like, why would that bother me so bad? Moving my arm this way. And it's like, well, do you ever move your arm this way? Well, no. And it's like, well, you know, what we need is we need
yeah,
to get your arm moving in a lot of different directions. I gave her the whole rubber band story and how, over
yeah,
time it tightens up and it doesn't have the extensibility that it needs to have, but we can get it back by working with it. And,
mm-hmm,
so we got her on a whole range of nerve glides. And again, like you were talking about in the last podcast, just variants like arm on the wall, hand on the wall, arms on the ball, some things to do, standing, putting her hands on the countertop, walking backwards. So we're getting the whole trunk involved. Um, Working into, and then we modified her exercises into ways that she could actually do some strength training that didn't cause pain. So
mm,
countertop push-up, she could do just fine, especially if she kept her elbow in by her side. It didn't go as well as if her elbows went out, but if her elbows stayed in, she could do it. She felt good about that. That was like a strength training exercise. We changed the lat pull down from being way out, at a big Y angle into the two ropes, that had the little balls hanging off of them that you can grab and start
yes,
and pulling
yeah,
down for triceps
mm-hmm,
and for lat pull down. So she could do up and coming down, and then she could do it with her elbows locked for the triceps, so that she could get these muscles going and some strength training going that felt good. And then eventually she was able to kind of like move out from those, initial positions and postures.
Did
And
she have like a capsular pattern of restriction in her shoulder? Like, did she
no,
have any mobility issues? Okay.
no, not
Huh.
really. Like I said, the only issue that she had, like she could flex her arm up. She was like at about, I don't even remember the numbers, probably around 160, 165. It wasn't bad.
It's not
She
bad.
had
Yeah.
pretty good abduction. She was a little limited in external rotation. She had more pain with like resisted internal rotation.
Yeah.
Which would make sense to me after a frozen shoulder, the subscapularis overactivity to
Yeah.
lock and hold that shoulder down,
Hmm.
through the pain response. So, but the neural tension pieces, going into abduction and then pulling the arm back, that would cause it. Going into abduction and adding external rotation and pulling the hand back again, like doing the tensioning pieces on either
Hmm.
end from the neck and from the hand or what would spur it on. And so
Yep.
we were able to use that and say, when you lay on your back to do this exercise, be sure your head is straight. Like, don't
Hmm.
like have your head turned or off to the side or anything like that. Or be sure your wrists are neutral, so
Yep.
that, as you're going overhead with something, your hand isn't going backwards or, things like that. So that, she could begin to, I said, that way we're going to stress the system for it to change, but we want to snuggle up next to the discomfort and not really create more discomfort because that's going to cause more of that protective response, that
Yeah.
pulling back again, pulling back
Yes.
again.
Yes.
Mhm.
I love that.
Yeah. So
I
just
love that.
keying in on what she already knew about her own protection system, helped her kind of understand, oh, but if I do it this way, it'll be okay. Because she had it in her brain that she couldn't do anything to stress it because it would hurt. But it was only the ways that she was doing it. And again, we get that way. That's why as humans, we don't want to be isolated. We really need to have, talk things through and be in support of because the modifications I made were easy,
Yeah.
but they
Yeah.
were relevant to her because she really wanted to do this. It was like,
Yeah.
then let's
It's
find a way for you to really do this.
like my guy with the push-ups yesterday. We put him on the tricep on our prior podcast, 228, with the tricep bars. You're just making it easier for her to do, for just to give her a different environment.
Right. And as she got better, I shifted her over to my go-to Pilates master. And,
Mm,
set her up so she understood what she needed to work on. And of course that
mm,
she loved Pilates and the strength training and the changing from that too. And that opened up a whole new world for her. So,
yeah.
and one that she felt like was doable for her, even at her age, because she wasn't careful or cautious, like, oh, she would climb a ladder if she needed to. But um, she just felt like she didn't know she could, make such great change. People think Pilates is for like the 25-year-old.
Yeah. Oh no, no, no,
Right.
no,
I
no.
know,
Yeah.
I know. Most of our listeners out there know, but the
Yeah.
public, sees a young,
Yeah.
small body, and that's who
Yes.
goes, you
Yes.
know?
Yes.
So,
Yeah. Yeah.
yeah,
Yeah.
so
Yeah.
it was good for her to, have that to have something new
Yeah.
to do.
Yeah. It's just so interesting though, because if you think about, because I'm just sort of harping on, not harping, but on the decisions she's made over the years
Mhm.
to what, like when she says chronic bike riding, whoever says chronic bike riding, like, that's like an interesting
No.
term, right?
Mhm.
And
That's why
then like
it's
she just,
like you can't make this stuff up. That's why you have
I
to ask
know,
people and talk to them and get curious, like, what does that mean?
I
Because
know.
people have their own terms and their own euphemisms and their own, metaphors that they use for things, and that's how
Yes.
you make sense of their world.
Yeah.
And
And it's exactly. And until I think as physical therapists, as a profession, we make people aware of things that they never would be aware of in the past.
Mhm.
How their prior injuries or prior movement or prior trauma or prior whatever can possibly be related to why they're standing in front of us.
Mhm.
And it goes back to all of our episodes where we've reinforced the power of the story, the power of the narrative, and
Yeah.
asking the right questions, right? And take a pause, and say, because I don't know this person from a hole in the wall. And I was just like, no DEXA scan. Why is she chronic bike riding? She stopped. That's not common. That's not
Yeah.
common, right? And so when it's not common, my radar goes up. And would she, have benefited from you know, somebody who didn't ask for all these questions?
Right.
No, no,
And that's the key here is that you gotta keep asking, you've gotta get curious, and don't stop at the first thing they tell you,
right,
right? You gotta
yeah,
spend the time and really continue to get curious. I even asked her, I said, "And before the bike riding thing, like, you said you did this in your 20s. What were you doing when you were 18, 19, 20? What were you doing when you were 15,
hmm
16, 17? But,
hmm
did anything happen? Did you get sick?
hmm
What's like, did you have any injuries or illnesses, significant ones? Because
yep,
sometimes you never know what they've got going on. Is everything else okay? Like, are you
yep,
having any problems with anything else? Like, how's your balance? How's your gut health? How's your urinary system? How is all of this working optimally for you? Is it, what are we looking at here? Are we looking at a bunch of systems that could all be involved? Or are we
hmm
looking at, but does she have chronic inflammation? You said your inflammatory markers were up around the time of the frozen shoulder. What about now? You
right,
know, those things you got to kind of just keep drawing the strings across and having let the story emerge from it. And
yeah,
but
yeah,
then when you help them see their story, because it's their story, and you do it without judgment, they begin to start realizing that, okay, that this is why this has happened.
right.
And there are things that I can do to change it.
Yes, exactly, exactly. And it, I mean, I ask patients to have heart palpitations a lot because, especially as women get older, it's a symptom. It could be a symptom of menopause and also just chronic thoracic dysfunction. I ask that a lot. And this woman I just saw, she's like, "Oh, no one's ever asked me that." I'm like, "You gotta ask that because that'll lead you down a diagnosis path
Mhm.
and asking all those questions.
Mhm.
It, it, you have to because and one thing I started doing more of is asking questions that relate to the sympathetic nervous system. And I know we probably do that. It's just that I've been very intentional about it.
Mhm.
SNS symptom anxiety,
Mhm.
sweating, heart palpitations, and if there's a few there's like 3 boxes checked off, wherever their patient symptoms are, that I'm looking at the thorax or I'm thinking something. I'm thinking something
Mhm.
for whatever I'm thinking
Yep.
something, right?
Yep. The stress, anxiety, depression scale is really good for that
Oh,
because
that's right.
you
That's
can
right.
check off they'll check off the boxes and they'll see they'll be able to see how I had no idea that this was affecting me this way.
Yes.
When I see it like this, I understand it better because most people will say, I don't have stress. I'm fine. I have a good life. I have a happy marriage. I have great kids. And it's like, we're not talking about that kind of stress. We're
Right.
talking about the physical symptoms of it, the
Yeah.
physiological stress that still
Yeah.
the wheel is running on fire back there.
Yeah.
And
Uh,
we're not talking about you're emotionally happy. That's great. But that you can still have strong physiological stress with that, and like being able to, and that scale is kind of good about pulling a little bit, it's a cursory scale to start with, but it's good about pulling some things out. Like if they're like checking all the depression ones, it's like, do you have support
yeah.
for this?
Right. Because
Maybe that's, that helps you prime the ground for them to like seek out therapy. I
hmm
thought, yeah, I used to go to a therapist and I thought I really, I'm just wondering if this is just as good as it can get. And so I've just kind of left it there. Or sometimes they'll say, no, things have gotten way worse. And I just really was hoping not to do that. It's like, but it helps them see that, maybe I need to, get some support. Like, let's help people get the support they need.
yeah. I mean, yeah, because I actually am doing a case study right now for school and for my doctorate, and I actually am filling out the forms myself as well, just because. And I filled out recently, I think it was the PROMIS, PROMIS,
Mhm.
and scale, as well as the central CSIA and B. And I did that for me. I just did it because I have a couple of injuries right now. And I realized how strong the narrative is in myself,
Yeah,
emotional and
yeah,
cognitive domain. I urge any therapist to fill those out themselves, because you
absolutely.
realize it's not, and I am very much a figure of, movement, and we all are specialists in that. But for my particular issues, I could see how my hip and my shoulder pain are affecting my quality of life. And that's more important than getting rid of my symptoms.
Yeah.
That's what came up in my little test to
Mhm.
myself. And so if anybody has a therapist who's listening, or anybody, if you're not a therapist, you should see one. But for physical therapists who are listening, you should, I would fill them out yourself. And if you've had injuries, it really opens your eyes, and it really helps you
Or,
help your patients better,
yeah,
right?
or just kind of what's going on with you.
Yeah,
Sometimes things are insidious, but if it's affecting a piece of you that you're just kind of blowing off, or, the big story is, I'll deal with this when,
balance. Yes.
and that you
Yeah.
can't make this conditional. The
Right.
whole thing is like, and our clients do that. And I can tell you that's the biggest part of burnout that I see in our profession is I'll be happy when.
Yep.
I'll be happy when I finish my paperwork.
Yeah, I know.
I'll be
Yeah.
happy when I finish this. I'll be happy when I do this. I'll be happy when I can switch over and work part-time. They're making your happiness in your life conditional
Yes.
on something else occurring that may or may not occur.
Yeah. Yeah.
Be happy
Yeah.
now.
Yeah.
Like you said,
Yeah.
you're like, I've got to change my narrative now. I don't want this
Yeah.
to be like affecting all of this other stuff.
Yeah.
Yeah, I can deal with the shoulder pain and the hip pain, but I need to be like my quality of life now. This is what needs to change. And so being able to like bring that up takes it out of that conditional aspect, which is like so important.
Yeah. I mean, why put up with it if we don't let our patients put up with it?
Right.
We
Or if we
treat ourselves
question,
worse than
or if
our
we,
patients.
or if we question why they're putting up with it or why they're not getting
Yeah.
better.
Right. Well, exactly. Exactly. And that's
Mhm.
another episode. But yeah, but it opens your eyes as to, especially for me, because it's more about quality of life, and enjoyment, versus I need to get rid of my hip pain. I don't really care about the hip pain. I just want to be able to walk 2 miles home.
Yeah, exactly. That's what
Right.
you want. And that's where those questions come in. They come
Yeah.
in and they say to you, I just need my hip pain to go away. And if your hip pain goes away, what will that do for you?
Yeah.
Oh, well, I'll
Right.
feel better and my hip won't bother me. And what will that do for you? And
Yeah.
eventually you'll get it. I'll be able to walk home from work for 2 miles and I won't have to think about my hip.
Yeah. That's
Wow.
the root of it.
That's what we
Yeah.
need to work on. Okay,
Exactly.
walking is relevant to her, being able to do it without thinking about it. There's all these things start coming up as to how this person can begin to change that and to get, like to get that back. And it's
Hmm.
like, and then when they know that that's the goal, this is what I want in my life, they're more likely, we're all more likely to do the stuff that's difficult, such as our home exercise program,
Right.
or make it more
Right.
sustainable to, okay, I can't walk 2 miles, but I can walk a tenth of a mile. I wonder if I could
Hmm.
do that twice a day. And with the
Yeah.
goal being, oh, I can only walk a tenth of a mile, but instead, oh, walking this tenth of a mile every day is going to help me get closer to that 2 mile walk that I want to be able to do.
Hmm. Yeah.
And,
Yep.
if you're 1% better every week, you know, I mean, in 3 months, gosh, you'd be so much further down the way. And
Yeah.
if people don't want, they want 10% or 20% or 30% better in one day.
Yeah. Yeah.
It's like, no, and that's why finding those things out are so important,
Yeah.
because you're going to find different ways to like start doing things.
It,
Because that's important to you. It's like, okay, this is it. This is where I need to be.
yeah. Yeah. It
Not
makes the treatment. Exactly. It makes not the treatment easy, but it makes treatment very focused. It also connects the patient to the outcome. Some
yeah.
patients are like not even connected to the outcome because you're not
No, 'cause
working
they
towards
don't.
the outcome that they
Yeah,
want.
yeah. You've decided their outcome.
Right.
right? You
Exactly.
can't do that. They have to decide. That's their vision, their goals.
Yep.
And
Yep.
I think as professionals, it's incumbent to us to teach them to make to teach them how to set a vision and a goal.
Yeah.
What is a vision for yourself? If this went away, what would your life look like?
Yes.
That kind of thing. Something, it doesn't even have to be fancy, just simple, but so they can be like, this is the compass, this is where we're headed.
Yeah.
Now, how we get there, we'll figure that out. But
Yeah.
at least we know where we're going.
Yeah. Yeah. Years ago, I had a patient, real quick. She was talking about a sport she loved to play. And every time she talked about it, her face lit up. And she's like, oh, I love to do this. And I said, and I said to her, I said, I don't know if you've noticed this, but your face is lighting up when you're talking about it. You look happier. And then what did she do? And when I said that, she started to
Mhm.
cry. And I was like,
Yeah,
okay. Right. And so this is years
it's
ago. And
super
I'll never
important
forget
to you.
that.
Yeah, and you've lost this
Totally.
part
Right.
of you.
Yeah. 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 So you kind of have to go there sometimes. Anyway, it's a great episode. Uh, yeah, I could talk about this stuff all day long, as you and I both know. We both could do this.
Mhm.
So, but
Yep.
we're trying to keep our episodes under an hour, so for the listeners. Um, yeah. Well, we have, so this is 2 to 9, right? You said 2 to 9. We have 2:30, and we're going to be, um, yeah, we're going to be taking a break over the Christmas holidays. This will probably air around Thanksgiving.
Mhm.
So happy Thanksgiving. To those of you who are in America and who celebrate it. And for those of you who are new listeners, thank you again for trying us out. And if you've liked what you've heard, we'd love for you to give us a review on wherever you listen to us. And we have our website, touchatreat.com. You can listen to us there if you'd like as well. And if you have any, I actually still do this, believe it or not, Susan. I go into our website, I type in, knee pain or thorax or whatever, and all these episodes come up, and there's a ton of them now. And so
Mhm.
I know it's really hard for listeners to listen to all of the episodes, but if there's something you're interested in, just type it in the search bar, and there'll be several episodes, some from 2018, some
Yep.
during the pandemic that we did, and some recent, and they've all changed. So well, there you go. On to the next episode.
Yes. Thank you, everybody.